All right. Assalamu alaikum and a very warm welcome to you all. First of all, I would like to thank everyone for taking out their time today and for joining us on the webinar on an important topic regarding Ramadan, diabetes, and mental well-being, where we will be talking about how to manage diabetes during Ramadan. Now, a little introduction about diabetes is that it is a chronic, serious disease where the body cannot properly manage blood glucose or sugar due to insufficient insulin production or ineffective insulin use. For that being said, I would like to introduce our esteemed guest speaker for today, who is Dr. Bisma Benares. She has completed her MBBS from Khyber Medical College, where she demonstrated exceptional academic excellence by earning 12 gold medals during her medical graduation. Following her graduation, she relocated to Saudi Arabia, where she practiced medicine for 6 years, gaining extensive clinical experience in diverse healthcare settings. Driven by her passion for advancing her expertise, Dr. Bisma successfully cleared the UK specialty examinations and pursued further professional development. She completed her specialization in general medicine and is currently undertaking higher specialty training in diabetes and endocrinology in London, refining her expertise in managing complex metabolic and endocrine disorders. Her journey reflects the dedication, academic brilliance, and a strong commitment to excellence in patient care and medical advancement. With that being said, I would like all of you to please give a warm applause to our guest speaker, Dr. Bisma. Dr. Bisma, handing over the mic to you now.
Hello, good morning. Thank you so much for such a nice introduction. I'm Dr. Bisma, one of the doctor working in NHS London currently. So just a bit of correction. I did graduation from Bannu Medical College, which is connected with Khyber Medical University. So everything else is fine. So our topic of discussion today is diabetes and its complication in Ramadan. Just a quick check if everyone can hear me accurately. Hello?
You can be heard.
Okay, that's fine. So let's proceed with diabetes and its complication in Ramadan. So diabetes is a chronic metabolic disorder characterized by high blood sugar. In medical terminology, we call it hyperglycemia. So it is one of these illness which is very common in Pakistan. That's why my focus is on diabetes and its management is in Pakistan. So it's caused by defect in insulin secretion. Either insulin would be completely deficient or it would be there and it would be resistant. That's why insulin secretion, insulin action are both of them together. So from our perspective, sadly, we don't know about the long-term complication of the diabetes. That's why we just focus on what is happening in front of us. So from diabetician point of view, it leads to acute as well as long-term complication if it remains poorly controlled. So, why diabetes matter and why this topic I have chosen today? Pakistan has the highest diabetes prevalence in the world. Sadly, it is 31.4% of the adult population which is having diabetes in current era in Pakistan. Approximately 33 million Pakistanis live with diabetes. Another 26 millions have pre-diabetes. Pre-diabetes means a person is at risk of diabetes. If they are not going to control their blood sugars to modify their lifestyle, then they will end up having diabetes very soon. And fourth and foremost important is Ramadan. So Ramadan is deeply important to our faith, to our identity, especially when you are living abroad. Of course, in Pakistan, it's a traditional, cultural, religious thing, but outside country as well. Sometimes people suffer to manage their diabetes. They are unaware how to manage their blood sugars, how to manage their medication. So here I am to answer all your queries about this topic today. Diabetes crisis in Pakistan is real. The numbers are alarming. Again, 31.4%. Estimation is that by 2050, Pakistan will have more diabetes than the USA. Right now, Pakistan is already ranking globally number one, but in 2050, it would be more than US. 52% of diabetics in Pakistan have uncontrolled HbA1c. So HbA1c, the people who have diabetes they might be aware that HbA1c is 3 monthly blood sugar level that we check in the lab to see how is the control of diabetes. So 52% have uncontrolled diabetes, 60% have controlled fasting blood glucose, only 43% have heard about diabetes. That is the sad reality. I really want to raise awareness, and from now onward, it's my motive to raise awareness in Pakistani people and to help them manage their diabetes better than other countries. Am I going too fast, or you all are with me on the same page? Hello? I just want to make sure that everyone is listening, it's not going through the head. Hello?
I
Yes,
believe
listening.
you're going. Yes.
Yeah, okay. So now I will quickly discuss about what are the types of diabetes. Diabetes has quite a few types now. Previously, it was only two types, type 1 and type 2, but now we have more than 14 different types of diabetes, and every other day we have new discovery in the this field. So, type 1, I will just mention about the two major types which are well known in Pakistan and to make it easier at this point. So type 1 diabetes, it is autoimmune destruction of pancreatic cell. So anything which is autoimmune that is related, that is not coming through the genetics, that's related to the environmental factor, that's related to our mood, that's related to our behavioral changes. So it's also an autoimmune destruction of beta pancreatic cells. In type 1 diabetes, there is absolute insulin deficiency. There is no insulin at all. A person who is normally producing insulin from pancreas, here there is no insulin. So that's why persons usually end up on insulin injection. So there is no other solution. If a person has type 1 diabetes, they have to be on insulin. Medications will not do anything to this person. So usually patients present in childhood. That's why we see in childhood many kids are ending up with insulin because this is it is usually diagnosed in childhood and sometimes in young people as well before the teenage. It requires lifelong insulin therapy. Then type 2 diabetes, sorry. Type 2 diabetes is usually in adults. It's diagnosed, it's basically insulin resistance with relative insulin deficiency. There can be some insulin, but it's not working properly due to some defects in our body, due to some environmental changes in our body. It is strongly associated with obesity and genetics. Most common type of diabetes is type 2, and it's often managed initially with lifestyle and oral agents, which we call as tablets for diabetes. So, first line is always make lifestyle changes and go for tablets. Other types of diabetes can be gestational diabetes, which is specifically diabetes in pregnancy, and if it is not well controlled, it leads to the congenital problem or birth defects or intrauterine fetal deaths in the newborn. So, other types of diabetes can be steroid induced diabetes, pancreatic diabetes, monogenic diabetes. There are so many details, I will not go further into them. So, why are we at higher risk? This is the important point that why we are number one as compared to other nations. First thing is the genetic predisposition. Genetic predisposition is mostly for type 2 diabetes. Then traditional diet, the diet we usually eat is very high in refined carbohydrates. We are usually less active, lower physical activity, and often the diagnosis is made late. Many don't know that they have diabetes. This is not a blame, actually. It's just understanding that we need to understand our body. We need to know what is going on. So we need to be aware of the illness earlier as compared to being diagnosed late in the condition when we end up with complications. So why Ramadan here is clinically important? Prolonged fasting alert glucose homeostasis. Just to revise that again, diabetes is basically high blood glucose. So when we are fasting, our glucose homeostasis, glucose balance in the body is not up to its mark. So that's why we need to be aware what should be the timing for medication and dosing. What should be the dosing? Like, okay, if a person is already on diabetes medication, then how we will adjust the dose during the Ramadan. Then high risk of hypoglycemia and dehydration, and many patients fast despite exemption. So we will revise here that who are the best persons to fast and who should avoid fasting in Ramadan with diabetes. So, what is the role of mental health and social support? Fasting decisions influenced by beliefs, guilt, and fear. Mental health usually affects diabetes self care, and we have social workers who usually bridge medical and cultural needs. Now, let's talk about physiology of fasting. What happens in fasting that you are not eating, so your insulin screen is reduced. Normally, insulin is secreted whenever we eat. Whenever we eat, blood sugar is sensed by the pancreas, and then insulin is secreted from the pancreas. So, if fasting, there is no reduced insulin, increased glucagon, which is the opposite hormone of insulin that's secreted to maintain your blood sugars, and cortisol also as well, which is secreted during stress as well as to maintain blood sugars. So, in that case, blood glucose metabolism shifts from glucose to fat metabolism. So once you are going, because there is no glucose in the body, you have already fat in the form of body fat on your around your tummy, on your other parts of the body. So your body starts metabolizing glucose from fats. So when this fat start converting into glucose, there is a risk of low blood sugar and as well as one of the very serious complication of diabetes, which we call as ketosis. So, with this fat metabolism, and a person in diabetes will end up with ketosis, which is life-threatening complication of diabetes, which we call as diabetic ketoacidosis. So, Islamic perspective on fasting is preservation of life and health is paramount. Those at risk are exempt from fasting. So, if you are someone who has poor control of diabetes, who gets dehydrated very often, who have other complications of diabetes like the problem, heart problem, and any lung issues, and as well as if you're requiring high doses of insulin, then you are exempt from fasting. That's why medical advice is religiously valid. Don't say, okay, we ask Imam, and Imam is saying that we need to fast. No, your doctor is your Imam if you have some illness. Then risks tool called IDFTAR, which is International Diabetes Federation, Diabetes and Ramadan. This is a risk tool which we usually use to stratify the risk to see if a person is high risk, moderate risk, or low risk. So if you have anyone in your family or anyone in your relatives or anyone in your friends or anyone around you who seek advice from you guys that should we fast or not, so then you can just type this one and try to see the risks. There are numbers. You need to enter the different elements of this IDF dark risk. I will open this for you guys on Google in the end to let you know how this can be used. So then you can easily calculate the risk for a person who wants to fast. And if a person has very high risk, they should not fast. If a person has high risk, they should not fast as well. And the one with moderate to low risk may fast, but with supervision. With supervision mean if a person is living alone, then they should not fast definitely. But if a person is living with someone who can look after them in case of complications like with low blood sugar, with diabetic ketoacidosis, with any sickness, then they can fast if there is someone around. So, who are very high risk patients? Those patients who have poorly controlled diabetes, who have recent severe hypoglycemia, diabetic ketoacidosis, who are pregnant with diabetes, who have advanced kidney disease, and I will add here that who have advanced heart failure and any lung problem, like sometimes patients have lung problem and they are requiring oxygen. If they are requiring oxygen, they can be at risk of more dehydration as compared to normal persons. So those I will include here as well. Again, common complications could be hypoglycemia, which is low blood sugar. Your blood sugar can be dangerously low. And this is common post-iftar hyperglycemia. So here, whenever a person is doing breaking the fast, they usually end up taking foods which are high in carbohydrates, like you are taking in our culture, it's very common to drink ruh hafza on the as a traditional drink on breaking your fast. So that can cause post-iftar hyperglycemia. And then there is a risk of dehydration. Once you are dehydrated, you are automatically, with diabetes and dehydration, you are at risk of having thrombosis. Thrombosis means clot. So with clot, you can have heart attack, you can have brain hemorrhage, you can have stroke, you can have lung clot, which can lead to death as well. So these are the severe complication of diabetes, but those are only in persons who have poor diabetes control. Not all of them. And again, additionally, the ones who require more insulin doses as compared to the normal people. Then finally, the life-threatening complication is diabetic ketoacidosis as well. Then pre-Ramadan assessment. So now we are in pre-Ramadan period. We are still in the window, although ideally it should be 6 to 8 weeks before Ramadan, so that your body gets used to the situation, to the amendments, to the changes that you are making to your diet, to your medications. Your body will adapt to that in this time interval. But having said that, we are 2 or 3 days before Ramadan. We are still in window. So, what should be done in this time, in this period? Review your HbA1c. If your HbA1c is not checked till now, before Ramadan, then it should be checked. Just to let you guys know that HbA1c should be checked every 3 monthly. Every 3 monthly in ones who have poor control of diabetes. The ones who have good control of diabetes, we recommend checking HbA1c once in a year, like especially type 2 patients who are very good with their diabetes control. Then we ask them to check their HbA1c once in a year. But the one who require regular medication changes, they need HbA1c check in 3 months time. And also review the comorbidities. Comorbidities means the illness which are there along with diabetes, like I mentioned earlier: heart problem, kidney problem, lung problem, and dehydration or anything else. And lastly, medications. Medications, especially, we have two definite medications which need the persons who are on those two should avoid fasting. First is sulfonylureas, and second one is insulin. So, insulin patients are at risk of having low blood sugars. If you are requiring insulin 3 times in a day, then you should definitely not fast. Secondly, there is medication which I mentioned, that sulfonylureas. Sulfonylureas include gliclazide, glamparide, uh, glamparide. mm, so we have certain other medication which comes in sulfonylurea. So those persons should not fast. But if they are eager to fast, then we do have amendments that we can made after medication. Like instead of taking the sulfonylurea medication in the morning, we suggest them to take it in the evening, like with fatur instead of with suhoor. And lastly, assess mental health and social support. Social support, if you live with someone, if you live with your kids or with your family, then that is social support. And assess your mental health. If your mind is really in a condition to go ahead with fasting, if not, then definitely you should avoid fasting. Again, medication adjustment, oral agents, usually metformin. Metformin is a very common medication we use for diabetes, which we call as glucophage in Pakistan. So glucophage is generally safe. Secondly is sulfonylurea. Sulfonylureas, as mentioned, it includes gliclazide, glamparide, and biguanide. There are multiple 8 to 10 types of sulfonylureas. Those patients are at risk of increased hypoglycemia risk. So their blood sugar can drop down quickly. So that's why we either change this medication to a safe one, or we change the timing. Or if person is having poor diabetes control, we usually stop the sulfonylurea. Then is the DPP-4 inhibitor. This is another type of diabetes medication which is low risk. And lastly, SGLT2. Usually this medication, SGLT2 inhibitors, it's not only prescribed in diabetes, it's also prescribed in kidney problems, in heart problems. This is very effective medications for kidneys, heart, and diabetes. So that's why most of the patients are on these medications. But we should be very careful about this, because during fasting, patient is is dehydrating. So the patients with SGLT2 inhibitor, they are at risk of having euglycemic ketoacidosis. That's why we usually avoid this medication in the sahur time as well. So medication adjustment. So this is for the doctors. If in insulin, if a person is on insulin, we usually have patterns how we give insulin to the patient. It can be basal and bolus regime. So if a person is on basal insulin, we need to decrease the dose. Bolus insulin, we make it more after iftar instead of going to sahur, because If we will give with sahur, patient will end up with hypoglycemia, not eating anything in the daytime, and blood sugar will drop dangerously low and severe complication. And avoid aggressive dose escalation. So we should not make dose adjustments straight away. Okay, if a person is on 20 units of insulin, go to 10 units. No, in this way, also it's not good for diabetes. So we need to make the adjustment in correspondence to a doctor, a physician. Glucose monitoring. This is the important point that you can contribute to. Um, Glucose monitoring, just checking your blood sugar does not break your fast. So you are still fasting if your blood comes out and you're checking your blood sugar just to be safe. It's essential for your safety. And if your blood glucose is less than 70 or more than 300 milligram per dl, then you should definitely break your fast. That is dangerously low or dangerously high figure. So you should definitely break your fast at this point. And how often you should monitor, it depends on how good is your diabetes control. Usually we don't recommend checking blood sugar early in the before noon. We recommend checking them in the afternoon, like at 3 p.m., then 5 p.m. if your fasts open at 7 p.m. And you can do early check as well if you are experiencing any signs of low blood sugar. So what are the signs of low blood sugar? You can have shaking of body, you can have tremors, you can have palpitation, sweating, headache. And most of the people they say, I don't feel myself. So that is also a sign of hypoglycemia. If you're someone with diabetes and you don't feel that it's your normal self, then you are at risk of hypoglycemia. Check your blood sugar, make sure it is not low or not high. And this dangerously high value, why you should break fast here? Because if your blood sugar is 300 or above 300, you would be dehydrated. Your body needs water, your body needs medications. And if you will not control your blood sugar at this level, then it will be dangerously high. So that's why we advise breaking fast. If blood sugar is less than 70 or more than 300, you can take a note of this number. Next one is nutrition during Ramadan. What should be your nutrition as a diabetic patient? So we recommend balanced iftar meals, the one with complex carbohydrates at suhoor. So complex carbohydrates include the ones with brown sugar. Instead of using white sugar, use brown sugar. Instead of white bread, use brown bread. White atta, use brown atta, and chakki wala atta, but that is more safer as compared to this. And then the carbohydrates which are in fruits. Sometimes we eat fruits and we say, oh, fruits are safe. No, not all fruits are safe in diabetes. You should be careful about the fruits as well, like grapes. They have very high content of active carbohydrates and they are dangerous for diabetes. So you should avoid grapes, avoid mangoes. Oranges have very high content of sugar, but if a person has good control of diabetes, then I sometimes recommend, okay, you can go ahead with only one orange. Sometimes we are starving for some fruits, okay, we can take only one. And then the fruits which are safe, safe ones are the berries, blueberries, strawberries, apples are very good for diabetes patient. And in some patient, even banana work. Some patients can have high blood sugars with bananas, but some, so it's not only the related to the illness, it's also variable from person to person. Some persons can have good metabolism and other will have poor metabolism. So some persons are tolerating even the bananas very well. And then dates. Dates are also very good, but not too much of dates, one or two maximum. And avoid excessive sugary foods like this ruh afza, the fruits I mentioned, and then the desserts we take usually kheer, saviya, all those have active white carbs and they are not good. And pasta, even pasta, burger, junk food, that will cause to erratic blood sugar control. That is the physical activity. Although physical activity is limited during Ramadan, people are like, okay, I'm fasting, I cannot do physical activity. But to be very honest, I will promote it, especially after iftar. Because after iftar, you can eat something if you are ending up with hypoglycemia. So try to do at least light to moderate activity, at least 5 to 6,000 steps in a day. If you are someone who is making iftar and then already working or engaged with kids, then definitely you would be already moving 6,000 steps in a day. So I would not put more burden, but I would advise the rest of the people who are working from home, usually less active, to go with light to moderate activity. Avoid strenuous exercise, especially during fasting. And Taraw contributes to physical. Tarawih is also physical activity because we also stand up for quite a long time. It's like type of exercise that we guys are doing, if especially if we are doing 20 in numbers. Then the psychological challenges. Psych team is more aware about these psychological changes. But being a diabetologist, I will say that sometimes people are fear of stigma if they are not fasting. So that's the important point here, that we are not looking for ourselves. We are looking for stigma. Okay, what that person will say if I'm not fasting. No, it's your health, it's your body. At the end, you are the one who will suffer, not the person who is saying about you. So look after yourself. Don't be afraid of stigmas. Then sometimes there is guilt and religious pressure. As I mentioned earlier, that here your religious peer is your doctor. So take advice from doctor. They will not give you unnecessary or bad advice if you are suitable candidate to fast. And then lastly, some people are anxious about hypoglycemia. So if you are someone who are taking complex carbohydrates, which I have mentioned earlier, even proteins, especially pulses and meat and chicken, taking them in moderation will decrease your risk of hypoglycemia as well, because protein will end up being converted to carbohydrates. So if you have taken good sahri with medication which are not causing low blood sugar, then you should not be anxious about having hypoglycemia. Your likelihood of getting hypoglycemia is like a normal population person. So how we guys can help? I heard that many of you guys here are professionals. So how we can help? So you can do non-judgmental counseling. I tried to touch base this on my in this webinar today. So non-judgmental counseling is the key. Many people are just waiting for a few words from a professional coming up, few words of satisfaction, few better words which can align with their lifestyle and their medication. Secondly, clear safety medication. Although I was feeling that I'm being more blunt here about complications, but we should deliver clear safety messages. This is safe line, this is unsafe, so this is your borderline. You should not go ahead of this. If you will go ahead, you will end up giving complication to yourself. And then empowering informed decision. So I believe psych team here is the best one to address these concerns. Then let's do some case discussions to make it more interactive. So, if there is a middle aged patient with type 2 diabetes and wants to fast, they are on multiple medication, how would you approach this patient holistically? Hello? Hello? Hello?
If you all want to write your answers, please, you can write them down in the chat box of the meeting.
Definitely looking to your doctor's suggestion would want to collaborate as a psychologist, okay? Okay. So here I will just quick give you a quick advice. Sorry. Quick advice, like if it is someone at your home and they have taken advice from doctor and their diabetes is well controlled, so what is a quick, that is the purpose of this webinar, that I want to raise awareness besides doctors and medical professional. If you guys can raise some awareness, if you guys can help with something around the people, you, so middle-aged patient with type 2 diabetes who wants to fast and is on multiple medications, so we need to check if a person is on sulfonylureas. As I mentioned, there is only three in now I will say three. First is insulin, second is sulfonylurea, third is this DPP4, these SGLT2. These medications are usually not safe, but if they are in this, who change them to fasting time, to iftar time instead of sehri time. So that is the one. Secondly, taking complex carbohydrate. Thirdly, avoid exertion, especially strenuous exertion. continue with your routine self, and very well said that take advice from your doctor. But holistic approach would include psychological care, social care, and medical care. So medical care would be provided by the doctor, psychological care would be provided by the psychologist, and social care would be provided. We should be socially acceptable for such patient. I think the most important thing which is lacking in our society is no social support. Very few people are having social support with their illness, sadly. So the key message here is safety over ritual. Individualized care is essential. Multidisciplinary support improves outcomes. So multidisciplinary, I mentioned that it would be the patient, it would be the social worker, social care worker, which is the family member around, and then the psychological person, and then the doctor. And also sometimes you will get great benefit from the nutritionist as well. Now let us see this. What does blood sugar drop the most during Ramadan? We discussed this already. So what's your answer? At what time the blood sugar drops most during Ramadan? Is it before iftar, after iftar, before sahur, during day? What time do you think? Any answers? So I will quickly go through because I think our time is running far. So 2 to 3 hours before breaking fast is a person is usually at his risk of having low blood sugar. So at that time, if they are having any symptoms like dizziness, tremors, palpitations, then they should check their blood sugar. And if it is dangerously low, they should. Yes, Zara. Question is what time is the risk of you are at risk of having dangerously low blood sugar? So this is before iftar. So this is the second question. If your blood sugar is 65, what should you do? So if your blood sugar is less than 70, then you should never fast. If your blood sugar is less than 70, then you should fast. If your blood sugar is less than 70, then you should never fast.
Hello? Hello?
Hello, yes, the speaker must be having some connection issues. Yes, she's back.
Oh,
I think.
can you guys hear me
Yes,
now? Oh, no?
yes, we can hear you.
Oh, okay. So I was just going through the takeaway messages. Unfortunately, now I opened on mobile instead of phone, laptop. But we'll quickly revise the takeaway message. So first thing is Yes, first thing is get assessed early. This is for the next time as well as now you are in the window. See your doctor 6 to 8 weeks before Ramadan. Use the IDF dark risk calculator. So you can write this terminology with yourself as well. IDF/DOR risk calculator. Then third thing is medication adjustments is very important before Ramadan. Fourthly, it's the monitoring which is essential, especially the last few hours before breaking your fast. Then know when to break your fast if your blood glucose is less than 70 or more than 300, or if you are feeling generally unwell. Eat wisely, avoid eating refined carbohydrates, choose complex carbohydrate and protein diet. And mental health matters, diabetes distress is real, seek support. And lastly, safety and faith go together. So be safe to go ahead with your faith. Thank you so much, everyone, for listening. If you have any question, I'm happy to answer now.
If any of you have any questions, you may raise your hand and speak up, or you can write your questions down in the chat box.
So, how common is this for patients to violate medical advice in nut fasting? And how does it's very common in Pakistan, especially even in my family members, I have seen it around. It's very common. People don't listen. They say, okay, we are Muslims and we should definitely fast. So, I would say almost 80 to 90%. Any other questions? So, if you guys have any questions in future, I would be happy to answer in the group. Sorry, I have to leave now. We'll see you again with another exciting webinar. Any questions you guys are welcome to ask in the group.
Yes, if you have any questions, you may write them down in the group and Dr. Bisma will reply to them promptly. Thank you again all for joining for this webinar and taking out your time. Thank you, Dr. Bisma, for enlightening us on such an important topic, especially when we should do our checkups on HbA1c and what foods we should take and not, and how we should prioritize our health over rituals. So that's a very important part I think we should all take away from this webinar. Thank you so much, everyone, and
It's a
we'll
pleasure
see
for
you.
me. Thank you for inviting me, though.
You're welcome. It's an honor to have you.
Thank you.
With that, I would conclude the end of the webinar. Please make sure to give your feedback in the group. That would be very helpful.
Thank you. Allah Hafiz, everyone. Take care.
Allah
Take care.
Hafiz. Take care.
Yes.